Hi, everybody. Thanks for joining Seniors Blue Book Live. This is Brittany Jennings, and today I am joined by Dr. Ottaviani from Coastal Orthopedics. How are you today?
Good, Brittany. Thank you.
Thanks for coming and spending your time with us today. We are educating this week and kind of honing in on balance for the month of September, but also talking about fall prevention. And you're a perfect person to learn from.
Yes, I actually do see I see all of our balance challenged patients here at Coastal Orthopedics. And we do see quite a few fractures and unfortunate results of balance problems. So it's something that I think is very important that we try and understand and focus on with our patient population.
Absolutely. Well, tell us a little bit about yourself and your history with Coastal Orthopedics.
So I've been with Coastal Orthopedics since 2001. At the time that I joined Coastal Orthopedics, there were only 4 docs. My husband and I my husband who's an orthopedic surgeon, and I joined at the same time, so that made 6. And we did not at that time have a physician who was taking care of spine pain. So they asked me to kind of head that up, and I got started with our spine program until we started hiring more physicians. And as the years have evolved, as we've hired more physicians, I've kind of evolved myself into doing other things with the group or with the practice. And it's been fun, kind of being able to tap into other areas of expertise that I was not able to really tap into when I was just started. We are now 19 physicians and a very subspecialized group. So very proud of where we've been and now where we are. So a physiatrist or a physical medicine and rehabilitation specialist. As a physiatrist, we are physicians of function. So we are physicians that you will see many times in the hospital taking care of traumatic brain injury, spinal cord injury, strokes, and also in an outpatient setting, we're usually with neurosurgeons or orthopedic surgeons managing a lot of spine pain, knee pain, shoulder pain. So we will take somebody who has a disability, and that disability could be pain from knee arthritis. It could be memory issues from a head injury. It could be muscle tightness or spasticity from a stroke, or it could be spine pain. And we will try and help them find new normals. So we are, again, we focus on functional restoration, and our training is such that we really understand the musculoskeletal system as well as the neurologic system. And because of this training, we're able to kind of help focus on helping people with their disabilities and finding new normals.
So September is a month, as I mentioned, that highlights balance and fall prevention. Does Coastal Orthopedics have any way to help patients prevent a fall and feel comfortable with their balance if they are having difficulty?
Yes, we do. And many people, what's interesting about falls is that falls can come from many different medical conditions. So it's imperative that a physician who is first introduced to a patient who's fearful of falling or who has had a fall, so that you do a thorough history in understanding how it happened, why it happened, and any preceding symptoms that they may have had. So for instance, if somebody has a cardiac arrhythmia, maybe they became lightheaded or they passed out. Somebody who has who has visual problems or hearing problems and can't hear people behind them and they get startled. Or somebody who has leg heaviness and fatigue, who might have problems with nerve issues in their spine, a peripheral neuropathy, which most people understand. So understanding where the deficits are coming from, where the falls are coming from, is very important, because then that can help you as a physician guide the patient into where they need to go. Do they need to see their cardiologist? Do they need to see a neurologist? Do they need to see one of our pain doctors? Can I work with them in a physical therapy program? Should I send them to an ear, nose, and throat doctor because they are having dizziness and we need to rule out some sort of an inner ear problem as well? What we'll do here at Coastal is many times if we see them for the first time, I will go through a very thorough history and physical exam with them, and either redirect them to the appropriate specialist, or many times I can actually manage some of their problems myself with a scheduled physical therapy program. Some of the exercise programs that I think are very important, especially for our older population who, let's say, are having a hard time walking, because again, when they walk too far, they have a lot of heaviness or fatigue in their legs, or they're having a hard time picking up their feet, or they have issues with their heart, and so they're afraid if they go too far, they won't be able to get back home again. So somewhat other ways that you can condition, as long as, if you have heart conditions, as long as your cardiologist or your primary care doctor are okay with it, you can join an aquatics program. Aquatics can be very helpful because it eliminates gravity, takes the fear of falling away, yet at the same time you can tone and help with your cardiovascular health. Tai Chi is also found now from a balance perspective to be helpful. Initially, they didn't really feel Tai Chi was helpful with balance, but now they're finding that it can be. So really, in getting into the gym and riding a stationary bike is another way that you can strengthen your legs. And in some of our patient population with back problems, they can bike better than they can walk. So the stationary bike can be very helpful for strengthening and conditioning as well. What's most important though, is that you don't stop. So some of the other problems that I've seen are the secondary problems. People are afraid of falling, so then they sit and they don't do anything. Now with that, you become very stiff, and now you've developed pain when you get up and start moving, and or you strain a muscle, or you just forget how to walk. And believe it or not, as we get older, if we don't have that connection between our brain and our legs intact, we forget how to do some of these activities. So movement is extremely important for flexibility. It's important to keep that connection going, and it's important for strength. So the program that I would most likely put together for a patient would be in a patient who has a peripheral neuropathy, or who has leg heaviness, fatigue, tiredness from circulation problems, or from a nerve problem in their back. We can also put a program together in patients who've had strokes, or somebody who might have a foot drop because they have a pinched nerve in their back. How about somebody who's wearing a boot because they have an ankle problem and now they have a leg length discrepancy? So most of those patients with lower limb, lower extremity problems, what we need to do is we need to focus on core stability, pelvic strength, and we also need to make them aware of their problem. We're giving them control over their problem. Many times people will come in fearful of falling, which by the way is part of the differential for falls, is a fear of falling. And fear comes from the unknown, not knowing what's going on. So if we do a good history physical exam, we explain to them what the problem is, and we explain to them what they're going to be learning in physical therapy. You're eliminating the fear. In physical therapy, they will challenge them a little bit and help them to understand where their deficits are and where their strengths are. And then what we do is we focus on those strengths. We also teach them on what might actually cause a fall, again, so that they can avoid that activity.
So do you have any tips that you can offer for those that are watching right now to work on their balance and fall prevention in their homes?
So there are a couple of tips that I would recommend. Number one, again, eye problems, any type of visual acuity issues or hearing issues need to be addressed. And then you need to follow up. If you have them, you should be following up on a yearly basis with that specialist. We also look at assisted devices. So if people are weak and they're having a hard time even going from one room to the other, do they need a cane? Do they need a walker? In addition, if they are having fall concerns, we shouldn't have throw rugs on the ground. If we have steps, then we need to put tape on the steps so you can mark the steps and they can see them. Especially at night, the hallways should be lit. So you can even get those little plug-in, sensors that you put on the floor. So when you walk by, the floor lights up. You should have a lamp at your bedside table. That's very easy to reach. So before you even step out of bed, you turn that lamp on so you can see the ground. If in the bathroom, you're having a hard time getting up and off the toilet, we have raised toilet seats. We have shower chairs. You can have grab bars in the shower as well. If the shower floor is slippery, you can put mats on the floor. If you have steps entering your home and you're having a hard time, sometimes we can get ramps made so that you can, it makes it easier to step on, and make sure you have really good railings to grab onto when you get into the house. So all of those home precautions, I think, are very important. Many times home health agencies can come out to your home and actually assess it for safety. And sometimes based on your diagnosis, we can even get insurance to cover that and some of the assistive devices that they recommend.
Absolutely. Well, I want to say thank you so much for spending this time with us today on this Seniors Blue Book Live. Our goal is to always educate people for safety, for their best quality of life. And you gave so many useful tips and information on fall prevention, balance. And I know if anybody wants to reach out to Coastal with Dr. Ottaviani, and you also have, of course, a group of other physicians all specializing in different parts of the body. You guys are a wonderful group, and I will put all your information in the post so that people can reach out to you if they would have any questions or if they would like to schedule an appointment with you.
Thank you, Brittany. Thank you.
Thank you so much. Have a great day.